right. Well, anyways, thanks so much, everybody. I am just going to be talking for a few minutes. I don't know. I know a lot of you, but I don't know all of you. So I'm Laurie Proulx. I'm based in Ottawa, Ontario. And I've been involved as a patient partner in research. I've been involved with a number of patient groups, but more specifically, I do work regularly with a patient group called the Canadian Arthritis Patient Alliance. And so I see some folks that I'm fortunate enough to work with there on this call as well. So appreciate you coming out. But I guess over the years, I mean, I've been involved in more specifically in trying to influence policy making as a patient partner, as someone who's had to rely on medications for pretty much my whole life. There's no doubt that that's had a pretty significant, impact on my life, as I was diagnosed with juvenile rheumatoid arthritis at the age of 14. So I've kind of seen, despite, say being in my 40s, I've seen already a lot over the last 30 years. And I've experienced a lot, I would say, in terms of my lived experiences and the ups and downs that go with that. And so I bring that, I guess, to every single thing that I do in the patient space. So last year, I was briefly hired to work as a patient advisor. I do not work there anymore for the Canadian Drug Agency Transition Office at Health Canada. And so a lot of that work is kind of headed over to Canada's drug agency. But in my time there, I wrote this report, which is totally publicly available just on the Open Science Framework. So, you can dig into this, I'll be honest, it is a bit of a beast of a report. And there's a lot in it. I'm literally just going to talk about the key gaps with the hope that, maybe that'll inspire some of our conversation around what a national disease or condition agnostic patient organization might be able to look like. So you're more than welcome to QR code that, and I'll put that in the chat after in terms of reading the whole thing. And so, as I said, the process used to sort of develop this report was very much guided by, first of all, my experience sort of working with patient groups, working as a patient partner in research. And I've done some work at the local hospital level here in Ottawa. I've worked a bit with CHEO as well, because I was a patient there at one point, as a teenager. And most importantly, my over 30 years of living with chronic and life-threatening illness. Like, I won't lie, I've almost not made it twice already in my short life. So that very much I guided the process I used for my work with Health Canada. It also involved consulting with some patient leaders. I mean, I was only there for like maybe 3 months at the end of the day, but I did have time. I was able to scope in some engagement beyond just me and my lived experience. So I consulted with Zell, Marnie Parody, Don Richards, Maureen Smith, and Linda Wellholm. And I did some review of like, what do other countries do, right? And this is where, I'll be honest, a lot of the ideas over creating a national patient disease or condition agnostic organization came from Zal. And then I did a deeper dive into what exists in other countries. At least in terms of what publicly available materials there were. And so what I found is, and I mean, like Lisa said, I haven't been told that I was totally off the mark, not yet anyways, but I'm always open to hearing that feedback, of course. But, across the pharmaceutical policy making system in Canada, right, that there just really is not that systematic and meaningful patient engagement, that a lot of folks working in these organizations do lack understanding of some of the foundational principles of engaging, things like compensation or maybe power imbalances, managing that, right, or the privilege position that they can be in, right? The fact too that we don't see broad patient representation, or perhaps diversity of patient representation that we would like to see, right? Nor do we see them in the senior leadership and governance of these organizations, sort of from the board down. or whatever their governance structure is. Lack of awareness and knowledge of patient engagement by these organizations and leaders, not really surprising given number two. They aren't really using inclusive processes, nor are they evaluating, or perhaps there's a role there for patient, third party, sort of more independent evaluation there. So all that being said, I mean, just trying to look at some of these bigger issues. I'll be honest, so many of the recommendations are really meant for policymakers, right? For them to do these changes. But there are some that we can do as a community. There are some of these things that we can do independently if there is the interest. And that really is focused on that national health condition agnostic patient-led organization, right? So some of the gaps, I mean, I was just putting out broader strokes about things. These are not set in stone in any way whatsoever, but some of the bigger gaps that maybe we could address or contribute to sort of looking across the system. Again, this is more pharmaceutical policy, but one might ask, maybe there's the possibility for other, hospitals or others, right? Provincial healthcare authorities to look that we could fill some of those gaps in terms of recruiting and building the capacity of patient communities, matching them to opportunities, maybe creating some standards around it. So the mapping of a streamlined, integrated, is more for the policymakers, because they need to do that. But again, maybe there's a way, right, as a priority that we could somehow influence that and move things forward. And I'll go a little bit into each of the gaps, so you can understand them. Like I said, not everything, like I said, many of the actions are sort of internal to policymakers. But again, let's maybe think about what are some of the things that we can do to, like as a national patient organization, what are some potential areas of focus, right? Maybe we can, have this organization led by patients, right? And exemplify a lot of what we're not seeing in in some of the decision makers out there in our space, or maybe what we're not seeing in research. Maybe bringing those patient leaders right into the organization, right? And maybe sort of managing and leading this organization, right? So by using some of those inclusive processes, because, I feel like we would have a sort of deeper understanding of some of those issues, because we've often been on the receiving end of not using inclusive processes and these sorts of things, and seeing the power imbalances. Another one is capacity building, like I feel fortunate that I've found a few funds last year or over the last 2 years, even within my role with the Canadian Arthritis Patient Alliance, to look at, sorry, that's the next slide, but to look at capacity building, right, for patient partners. So much it's been focused on others, right? But maybe there's something that we can do there, often sort of beyond. Often these things are often beyond the ability for a single organization to do, right? So there could be an opportunity there to kind of build some training, allow some mentorship, right, amongst the patient community. So people can step up and we can achieve some of the diversity, and hearing from marginalized groups that we don't see like involved in a lot of this work so far, right? Maybe find ways to work with those communities, right? To build accessible ways to engagement, right? And if we build it, we could then share that back or try to influence policymakers to do the same. So anyways, just some thoughts, right? I'm just kind of looking at each of them and trying to find opportunities for us. Like it's really up to whatever we all think. Um, So, and then kind of going back to my previous slide that I inadvertently skipped here, but again, what are some things that we can do around patient representation and seeing more patient representation in these organizations and in the governance, right? Maybe we can create some of those transparent recruitment and engagement processes like in a toolbox of sorts, right? So again, just some thoughts in terms of what role a national patient organization might have. I spoke a bit about the inclusive, or these are some of the things in terms of cataloging leading practices, right? Again, some of the things that we could do and even lead by example in that regard. And last but certainly not least, evaluation, right? So again, we could look at some of those evaluation tools, establish those standards by which we wish to be engaged, right? To act as a bit of a yardstick to others. So these are just, taking some of the gaps that I identified across the system in pharmaceutical policy. I think a lot of this could also be applicable in other settings as well. But with that, it's really just here in terms of, giving some ideas, some food for thought, really, in terms of what are some potential areas of focus, what sort of gaps this sort of national condition agnostic organization could have. So